Hi everyone, in this lecture I am going to talk about normal labor and we'll see what is the criteria so you can define this process is normal or not. So before that we'll see what is normal labor. So normal labor is a process in which many events are going to take place in a serial manner, and these all events are going to take place in a female's genital organ. And why it is happening? Because they need to expel out the product of conception, that is the fetus, placenta and the fetal membrane. So to expel out these products from the uterus, because normally these all product of conception are generally develops in a uterine cavity itself. So in a simple mean you can say that the fetus and the placenta which is expelled out at term from the uterus through the vaginal route is called normal labor. Okay. So what are the criteria in which you can say that this whole process is normal or not? So the criteria are as follows. Criteria for the normal process of labor is the first one, that is it should be spontaneous in onset. It should be spontaneous in onset. What it means? So in a spontaneous, the process of labor should start automatically by its own self. Okay. If we are inducing by mean of medication like oxytocin to start this labor process, then it is not to be called as normal one. So to meet the criteria for the normal one, there should be a spontaneous initiation of labor process, and when it is to be spontaneously start, it should be start at term. So what the term means if the labor is going to be start in between 37 to 42 weeks of gestation, then it is to be called as term. Okay, and if this labor process begins before 37 week of gestation, then it is called preterm labor, and if this labor process proceed beyond this 42 week of gestation, then it is called postterm labor. So the first important criteria for normal labor is it should start spontaneously, and when it should start in between 37 to 42 week of gestation. So it is very important. Next, the important criteria is the vertex presentation. Vertex presentation. Okay. So there are many presentation which lies in a lower pole of the uterus at the time of labor. So to meet the criteria for the normal one, what we are needed here is vertex presentation, because in vertex there is a head part which is overlying to the lower part of the uterus. So in a cephalic also, in a head part also, there are three. There is a vertex, there may be a face, or there may be a brow presentation, but we just needed vertex, because in a vertex presentation the head is in a flexion manner, complete flexion manner. Okay. So when the head is completely flexed, the presenting diameter will be reduced. So the available diameter of this vertex is smaller in compared to the rest one. Okay. So with this smaller diameter, the engagement is easy. Is that clear? So to complete the criteria for the normal one, we just needed vertex presentation, and if it is brow and if it is a face presentation, then it could not be normal one. Okay. Because in a face and brow presentation, what is happening? The head is in extended manner. The head is in complete or partial extension, but in a vertex there is a complete flexion of the head. Okay. So this is the ideal one to deliver by the pelvic root. So the second criteria is the vertex, that could be fulfilled, and the another one is that there should be no prolongation. Okay, no prolongation. Okay. So there should be no prolongation in the labor process, because there are 4 stages of labor that we will discuss later. There is first, second, third and fourth stages, and there is a stipulated time period for each of the stage, and if the time of the each labor stage goes beyond that period, then we will call as prolongation. So we do not want that there should be a prolongation in labor process, because in a normal condition there is a particular time period for a primi-gravid as well as for a multi-gravid woman, and if the labor complete within that limit, then it is called the normal, and if it goes beyond that, if it is taking more time to complete this process, then it is not to be called as normal. So there should no prolongation at all in any of the stage in a labor process. Okay. Next, the important thing, this labor process do not cause any complication to woman as well as the fetus. So without causing any complication to woman and fetus. This is also very important. Suppose everything is going very fine, first stage is very fine, second stage is very fine, and after the delivery of baby, sudden woman start heavy bleeding. Okay, so you can say that woman develops postpartum hemorrhage. So if this happen, then also we cannot say that this is the normal one, isn't? And along with that, if the fetus also develops some discomforts or any other adverse effect, like after the delivery of baby, the Apgar score is low. Okay, so in that also we cannot say that it is the normal one. So to meet the normal criteria, this labor process do not cause any complication to woman as well as the fetus. Okay, and the last one, this labor process should ends naturally. Okay, so natural termination with minimal add. So what it means? That the labor should end up without any interventions or without any assistance. Okay, this should not be happen that all things are going well, proper uterine contractions are there, but suddenly the fetal head is stuck. Okay, and this is not descending down. So in that condition you are using forceps or you are using ventose, and if there is a poor uterine contraction, you are using oxytocin. So if you are using these all assisting add, in that condition also this is not to be considered in a normal one. So the process of labor should terminate very easily without, or you can use very minimal aid to end up this labor process. Okay. So here we have seen the criteria to fulfill the normal process of labor, and if all these criteria are met, in this condition only we can say that this is the normal one and it is called as eutocia, that is a normal labor. And if any deviation you found in any of the step, like all things are well but there is a face presentation or the bro presentation, in this also you can say that it is a normal one. So to meet all the criteria for the normal labor, this all things should be included in that. Okay. Now next we'll see that if a woman is coming in a hospital and she is having pain over the all over the abdomen, then how you can identify that she just entered in a true labor process or not. Okay. So we'll see what is true labor pain and what is false labor pain. Okay. So true labor pain. It is very important because this is the term true labor pain we generally use in the first stage of labor, because the first stage of labor begins from the onset of true labor pain. So how you can define that the woman is having true labor pain or it is false? So if a woman is coming to you and she is saying that she is having pain, by this single statement you cannot come to a conclusion that she is having true labor pain, because to identifying the true labor pain you just need to observe for a period of time. Not by a single observation you can see that she is having true labor pain. Okay. So let's see how you can identify that this is a true labor pain. So for the true labor pain you just at least need to know what is the uterine contraction, because without that you cannot be conclude that she is having the actual contraction or not. So in a uterine contraction we are just measuring many of the things, because in a true labor pain the uterine contraction comes in a regular interval. Okay, and there is a we just need to monitor the frequency, duration and intensity of the contraction. So there are the three things we just need to monitor: the intensity, frequency and the duration of contraction. So throughout the pregnancy period, women usually have a mild, very mild contraction, and that we are called as Braxton Hicks contraction, and these contractions are not perceived by a woman, okay. But as the labor become progressed, these Braxton Hicks contraction become more intense, and the contraction, the pressure within the uterus become rises, and these turn or these change into the actual uterine contraction which is appearing in the labor process, okay. So how we can find out these uterine contraction are painful or not? So first we will see what is the meaning of this intensity, frequency and the duration of contraction. So here intensity denotes the uterine systole or the pressure within the uterine cavity at the time of contraction, okay. So with the first stage of labor, as the uterus become contract, the pressure rises. So with the progression of labor, the intensity become increased, okay. So the intensity increases with the progress of labor. So how you can measure this, the intensity? During first stage of labor, the uterine contract, and at the time of contraction, if you are monitoring the pressure within the uterus, it is about 40 to 50 mm of Hg, okay. And once it enter into a second and third stage of labor, then the intensity become more increased. Why it is increasing? Because in second stage the woman need to expel out the fetus, and in a third stage women need to expel out the placenta, okay. So to expel out these conceptions, the contraction become more rises, okay. So here we have seen what is the intensity, and along with this intensity, with the process of labor, the frequency and the duration is also increases, okay. So what is frequency? So frequency is a time interval between the contraction. So how regularly the contractions are coming, at what interval, okay. So with the same time interval, that is initially you are monitoring for a 10-minute period, and there is only one contraction, and later on within that 10 minute only there is 3 to 4 contraction. So the frequency of contraction also gradually increases with the process of labor, okay. Now the thirdly we monitor in the uterine contraction is the duration. How long the contraction lasts for? Initially it lasts for about 20 or 30 seconds during early first stage of labor. Once the end of first stage of labor or in a second stage of labor, the duration becomes 60 to 90 seconds, or even it lasts for about 1.5 minutes, okay. So these uterine contraction usually initiate starts from the uterine pacemaker, okay. Where it starts from? These wave of contraction starts from the pacemaker of the uterus, and where it is? It is in the tubal ostia. So here it is the uterus, and here is the tubal ostia where this wave of contraction begins. So these wave of contraction usually in this also the right side is more predominant than the left one, and here from this tubal ostia the wave of contraction usually begins, and this predominate the fundal region, and from the fundus part only the contraction usually moving downward, okay. So by this they create a pressure over the fetus as well as the pressure within the uterine cavity to expel out the fetus and to make the fetus descend down, okay. So here the first thing in a true labor pain which we have seen here is the uterine contraction. So regarding the uterine contraction, so what is the character of this uterine contraction? With the progression of the labor, these uterine contraction comes in a rhythmic, regular manner. They comes in a frequent, regular interval, as well as the intensity, frequency and the duration of contraction gradually increases with the progression of labor, okay. So this is the important key point in the true labor pain is the intensity, frequency and duration of contraction increases with the process of labor. After the uterine contraction, the another feature is the progressive dilatation and effacement of cervix. Okay, so this is another important point. What is happening here? The cervix become dilate. It means you know that throughout the pregnancy the cervix usually hold this pregnancy by closing the internal os, isn't so? So once the labor process begins, what is happening? There is a progressive dilatation. Okay, so progressive dilatation, it means suppose a woman is coming to you and there is a 2 centimeter dilatation and there is a 50% effaced, and later on after 4 to 6 hours if you are monitoring again, then you find that there is a 4 or 5 centimeter dilatation and 80 or 90% effaced cervix. So there is a progression. There is a progression in dilatation and effacement of cervix. Okay, so dilatation means there is an opening of cervical canal which is completely closed throughout the pregnancy, and here it is progressively open up. Okay, so there is a progressively opening of cervix as well as effacement of cervix. It means the cervix is taking up. The cervix is taking up because the lower part of the uterus is the isthmus, which forms the lower segment, and this cervix incorporate in the isthmus and it is taken up. It is merging in the isthmus. Okay, so once it merges or incorporate in the isthmus, the length of cervical canal become decreases. It is very important. So we just need to observe for a period of time that there is cervical dilatation or effacement of cervix is there or not. Okay, to check whether it is true labor pain or not. Now here, once the cervix become dilate, the another important feature which you see here is the appearance of show. So what is show? As I have already told you that there is a thick mucoid plug which is present throughout the pregnancy and which blocks the cervical canal during whole throughout pregnancy. So this mucoid plug, which is copious and tenacious, which is lying in the canal, with this progressive dilatation, as the cervix become dilate, this cervical mucus plug also release with this dilatation. But here, as the cervix become dilate, some capillaries also ruptured and the decidua also become unsupported with the membrane. Okay, so there is a bleeding because of the rupturing of capillaries, and this bleeding just mix with this mucoid plug and this is released through the vaginal route. So here the show means the mucoid plug mixed with blood coming through the vaginal route is also indicative of true labor pain. Okay, so after the show, what another feature we'll find? There is a descent of head. Okay, descent of head. So with the progressive dilatation, as the cervix become dilate, what is happening? And with this uterine contraction, the pressure is generated over the podalic pole of the fetus and the fetus become descent down. That is, the fetus is coming down. Okay, so that is called the descent of head or the descent of the presenting part. Now as the presenting part of the fetus is descent down and as the show is appeared, what next will find? That the appearance of bag of forewater. Appearance of bag of forewater. So what it is? The fetus throughout pregnancy is lying in an amniotic cavity, isn't so? So once the fetus or the presenting part descend down, the girdle of contact, it means the circumference of this head is just coming in contact with the pelvic brim. Okay, so once the fetal head descend down and it comes in contact with the pelvic brim, what is happening? The amniotic fluid in which the fetus is lying is just divided into two compartments. The one which is lying above from this girdle of contact, okay, and the fluid which is lying above from this girdle of contact is called hindwater, and the fluid, because there is some spaces in between this head and the pelvic brim, so with this girdle of contact, some amniotic fluid is seeping below and it comes in front of the presenting part. Okay, so the membrane and the amniotic fluid which is lying below the presenting part is called the forewater. Okay, and this you can easily palpate by the vaginal examination. So with the uterine contraction, as the uterus become contract, the pressure within the uterine cavity increases. So with this increasing pressure, the membrane become bulge, tensed, circular. So this bag or the convex structure which is lying below the presenting part is formed the bag of forewater, and the water which is lying above that is the hindwater. Okay, so this is how the bag of membrane forewater is formed, because once the cervix become dilate, the membrane which is lying below the presenting part just unsupported, because once they become dilated, these membrane just enter into the cervical canal with the amniotic fluid. So this is the another event that we include in the true labor pain. Okay, so this is the formation of forewater. Now the another, that because we are discussing here the pain, true labor pain, as we'll discuss in later, that the first stage of labor begins from the onset of true labor pain. Okay, so this true labor pain is not relieved by, enema or sedatives. Okay, so this pain is not relieved by enema or sedatives, because we are talking here about the pain. And pain, why pain is appearing? Because the uterus is contracting, the cervix is dilating. So there is with the uterine contraction, there is a myometrium hypoxia, because once the uterus become contract, the muscle fibers become contract, the vessels which are running through these muscles become occluded and they are not nourishing the cells. Okay, so myometrium become hypoxic, as well as the peritoneum which is lying over the fundus region with the uterine contraction also stretches. Okay, and with this progressive dilatation, with the cervical dilatation or the stretching effect, the pain, the woman may feel pain. Okay, so the sensory stimuli for the uterine contraction travel from the uterine body to the T10 to L1 segment because of the uterine contractility and the myometrial hypoxia and the peritoneum stretching, as well as the cervical dilatation stimuli travel from the cervix to the S2, 3, 4 segment, that is the sacral plexus, and these sensory stimuli which causes because of the contractility and the dilatation of cervix do not relieve by a simple enema and the sedatives. So this true labor pain, which usually cover all over the abdomen and especially the hypogastric region, do not relieve by the simple mean. They just require the epidural analgesia, that we'll discuss later. This is about the true labor pain, and if you compare it with the false labor pain, suppose if woman is having pain but it is false, so how you can identify that it is false? Because the contraction are not coming in a regular pattern. There is no increasing intensity, no increasing frequency and no increasing duration of uterine contraction with the progression of labor, and there is no dilatation and effacement of cervix, no appearance of show, no formation of bag of water, and once you administering the enema or sedative to a woman, that pain would be subside. Okay, because it is dull in nature and just confined to a lower near the groin region only, and that could be relieved by simple enema as well as sedative. So here in this lecture we have seen what are the criteria to define that it is a normal labor or not. It means it is eutocia or dystocia, and what are the features for true labor pain that distinguish it from the false labor pain. Thank you.